I'm a little bit of an emotional rock, but it's okay. Hey, my name's Cian. I'm a radiation therapist. I've been doing it for about 4 or 5 years.
My name's Cindy and I'm a registered nurse and a clinical facilitator. Oh, there's a number of them. I started at a new place as a casual and they were very excited to hear that I could do neurosurgery. I actually know nothing about neurosurgery, but I was really excited to go to this place to go and do my Eurosurgery. Urology and neurology is very different. So yeah, I rocked up there and said, oh yeah, I can do this, yeah, no worries. And then realised, this is embarrassing, I can't. For any scrub nurse to do something like that, they would understand.
Probably when I was a student, we used needles to do tattoos on patients. And there was one time, because I was like still pretty fresh, I didn't uncap the needle the right way. You meant to do it away from your body and I did it to my body. So like the cap came off pretty quickly and I like pulled it and it got me on the thumb. That was pretty embarrassing to say, I did what you told me not to do. No, well, I saw the nurses and they helped me out, so it was okay. There was a lot of paperwork though. Yeah, the paperwork sucked. Funny story. I mean, every day we try to make it as funny as we can. You know, we're working in a hospital. It's a pretty like serious gig, but we try to keep it light, try to keep it fun.
We were having a rough day in theatre out at Sale Hospital. Everybody was having a rough day. We were getting to the end of it and everyone's complaining, oh, my back, my this, my that. I had them do a quick yoga scene and we got walked in on by other staff. And I thought, well, that worked really well. So it worked well there. When I was at the injection rooms, every room is filmed. And so, yeah, I had some of the staff get up and do some yoga moves and bending and stretching, and somebody had a bag missing. So we had to go back through the film and there we were doing yoga. So I'm not sure where those films go, but they will see how much fun we have in our injection rooms. So.
Yeah, definitely. Like when you're at uni, they teach you to try and like build walls and separate your work life pretty heavily. So I feel like I'm a little bit of an emotional rock, but it's okay.
Does that lead into your personal life?
A little bit. My girlfriend probably doesn't like that I'm not an emotional man, but we'll get there.
What's the worst thing someone ever said to you?
Probably the most awful thing that was ever said to me was when I was brand new in theatre. I was an enrolled nurse and my educator at the time, who'd employed me, rolled his eyes at me and walked away. A few months later, he said to me, I used to look at you and think, what was I thinking by employing you? Later in that same place, I had spoken to him about possibly applying for my RN to do my registered nursing. He said, I don't think that's a good idea. You might just pass here, but you'll never pass here. Clearly, I had to prove that wrong. He was a big guy and he was very intimidating at times and I was just nervous. I was a nervous new person in theatre trying to learn the role and he was my educator and that is what I copped. So that was pretty horrendous and I never forgot it. But I've also done a lot of reflecting on it and I know that I would never say anything like that to any of my students.
When I was a student, I got told that I should quit because I would never make it in the industry. So, yeah. Just a person working at the hospital. Yeah, it was pretty full on. It was like, yeah, in one of my placements, so it's pretty hectic. It doesn't really give you a lot of confidence, but maybe it was a test. Maybe they were trying to make me stronger, so I'm still here. Joke's on them, or maybe they did the right thing, who knows?